I'm Dr. Ginevra, and welcome to day 8 of 30 Days in My Fibro Life. Today is Fibromyalgia Awareness Day, and in honor of that, I was going to talk about kind of the awareness of doctors about fibromyalgia. Typically, I think about Awareness Day more in terms of kind of advocacy, kind of patient advocacy, political advocacy, but I thought, since I am a doctor who also has fibromyalgia, I thought it might be interesting to kind of see how doctors, in my opinion, how doctors' opinions and understanding of fibromyalgia have evolved, and then areas where there's still room for growth. So when I was diagnosed with fibromyalgia in medical schools around year 2000, and at that point, I really hadn't gotten any education about fibromyalgia in medical school. And when it did come up, with my fellow med students or with my teaching physicians, it was spoken about pretty disparagingly, and definitely the prevailing attitude was that it was not real, that it was the hysterical woman's disease, that it was all in our heads. I learned pretty quickly to not say that I had fibromyalgia because I could feel the judgment and kind of stigma of that with my medical colleagues and fellow med students. So things started changing, though, in 2002 when a groundbreaking study showed that it was a brain scan study, and it showed that people with fibromyalgia, our brains interpreted pain signals differently, and that we had more pain compared to healthy controls. So basically, it confirmed in objective, repeatable way that our pain was real. And the problem with pain has always been it's somewhat of a subjective experience, right? So here they could see our pain on the brain scan. And that is where things really started changing. It took some time, but, I would say in the past 4 or 5 years, it's really kind of solidified to the point where most doctors and healthcare providers do understand that fibromyalgia is real. There's not so much of a question of whether somebody believes in fibromyalgia, unless they're a dinosaur doctor, as I like to call them, that really should have retired a few years ago. But like the young doctors, med students, people coming out of residency, they totally get it. They really are quick to diagnose fibromyalgia, and they absolutely believe it's real. So progress, yay. Where the big gap is now is in physicians understanding what to do about it. So, certainly most healthcare providers in the kind of conventional Western medicine realm are aware and use the 3 FDA-approved medications for fibromyalgia, but they don't know some of the actually more effective treatments like low-dose naltrexone, myofascial release, dietary interventions, treating hormonal imbalances. All of that is still sort of in the more integrative or holistic realm, but it is slowly moving more into the conventional medicine doctor's understanding. And that's, that gives me hope. And that is part of what my career mission is trying to educate other doctors so that they understand how to treat fibromyalgia. And, I do that in a lot of different ways, but one way I try to do that is in my book, The Fibro Manual. It actually has, the bulk of it is really patient-oriented, things that you can kind of do for yourself, but there's an appendix at the back that's really provider-oriented that has, easy to follow, well-referenced kind of guidelines that physicians could start, if they're like, hey, I want to know how to prescribe low-dose naltrexone. There's some references in there. So I tried to kind of do a more grassroots approach that way, with like patients bringing the information to their doctors. So I'm hoping that we can get better education of doctors and healthcare providers, and then also patients bringing the right information to their doctors to say, hey, I'd like to try this low-dose naltrexone, or what do you think about myofascial release, etc. So in the spirit of Fibromyalgia Awareness Day, today I raise my CBD beverage to everybody dealing with fibromyalgia. Keep fighting the good fight. Stay fierce. I'll see you tomorrow.